These people are taking back their dispensary. Built by their village and handed over to the government years ago, it never met real needs. The health of the community was mirrored by the health of the building. Now both are on the mend. The Tanzania Essential Health Interventions Project, TEHIP, showed that if you give ownership and control over key decisions back to local people and local officials, you can make a difference in health outcomes.
Mawazo ya kutengeneza zanati yalitoka kutokana na wilaya kutuambia sisi kwamba zanati nataka tutengeneze lakini kwa njia ya kujitolea. Na sisi tukarizika, tukawaharika wananchi wakakubali, ndio hii hali inaendelea mpaka sasa hivi kwa njia ya kujitolea.
Rebuilding the dispensary stone by stone and having the responsibility to run it and maintain it is making a difference.
Kwa nini imejengwa vizuri? Mjengo wa safari ya kwanza na safari tofauti. Kwa hapo inaonekana mzuri sana kwa safari hii tuliyojenga.
But that's not the only way communities are helping to improve local health care. This meeting is mapping the future for a community in the Rufiji district. TEHIP incorporated participatory processes to ensure community voices were part of the planning.
The village action plan, in which we shall participate with the villagers themselves to conduct an activity which will solve one or several of their problems. We have a list of problems which have been identified by the villagers themselves, and we shall sit together with them to seek some solutions to these problems. For example, one of the major problems they are complaining is insufficiency of services they are getting in the dispensary, especially the drugs. If they go to the dispensary, they say that sometimes they are being told to buy some medicines because they are not available at the dispensary. Now they want to solve that problem.
Solving that problem means making decisions on how to spend money and allocate resources based on local information. TEHIP has developed a budget planning tool for district health officials that is based on information gathered from people in the study areas. This local input helps district health officers make key decisions.
We've seen dramatic change in the skill sets that district health managers have. They are now managing as opposed to simply reacting. They are planning instead of just budgeting. They are doing many things differently, and they are organized better. They operate with more confidence. They're able to argue with the donors for a more rational approach to funding their district health plan. They have a district health plan. So that's a process change.
For example, the district health teams knew that refrigerators to store medication would be vital to the rebuilt dispensaries. And in areas not yet reached by mobile telephones, solar-powered radios made viable substitutes. Communications between dispensaries in a district was deemed to be very important.
We're seeing that they make different decisions in those plans now. They are allocating resources differently. There's now spending more money on the big problems and less money on the small problems. They are setting priorities, and those priorities are based on evidence. They're based on evidence of the burden of disease and evidence on what is effective in what they can do.
As a result, communities in the study area are seeing their health improve. They also feel they have a real stake in their healthcare system and can help create one that is responsive to their real needs and demands.